we can start the session right now. So good morning, afternoon, evening, good night, well, wherever you are. Um, Please be welcome to another happy hour from the Netherlands Research Integrity Network. Every month at 4 p.m. at Amsterdam time, we have the third Thursday of the month. We have a wonderful webinar with a variety of topics that touch upon research integrity and all things that are linked to research integrity. And today we have a special guest. Pauline Carrega is who's going to talk to us about open science, open data, and also the difference between the global north and the global south in terms of open science and open data. Pauline is a PhD candidate in the Earth, Environmental Sciences and Computer Science at the University of Manchester, but she also co-leads an initiative that's called the Bioinformatics Hub of Kenya to increase, and that's a hub that increases awareness of bioinformatics and open science in Kenya. And it aims to bridge the gap between early career and established researchers by building a cohesive community by, for example, running training events, doing outreach activities at different universities, but also running community meetups to support bioinformatics research and students. Apart from these two things, I also found out that her favorite song is from U2, which called Don't Stop Believing. It's indeed a wonderful song. And she's also really looking forward to the Christmas period, which is probably also in Manchester, but certainly also in Kenya, a wonderful period to spend time with family, for example. And today, your talk is about open science and open data. So please, a warm welcome for you, Pauline, and the floor is yours.
Thanks so much, Yuri. I'm going to share my screen.
Yeah.
And I am going to begin. Can you acknowledge that you see my screen and my slides? Oh, brilliant. Okay, so as Yuri has said, I am Pauline and I am a PhD student at the University of Manchester. And today I'm going to be talking about open data and policy frameworks in health and environmental research. So I switched up a bit from my field. My master's was in bioinformatics, but now I changed up a bit and now I work in health and environmental research. So just a brief overview of what we are going to be talking about today. I'm going to give a brief introduction about open data and research integrity, give some definitions, hopefully convince you about the transformative potential of open data in health and environmental research, policy frameworks in data use that we're already seeing in data use, research integrity and policy alignment, how we can be able to put all this together and do collaborative policy development. And by the end of this, I'm hoping to have convinced you of the importance of open data, how open data or open science and research integrity feed each other, and the role that policies play in solidifying this bond or relationship, and how we can be able to help make it even stronger. And yeah, future directions of open data and policy. So start us off. Open science practices advocate for research to become transparent and accountable. So open data is a branch under this open science umbrella and has been defined as open data that is accessible to use by anyone for reuse and redistribution. And some of the major values or qualities of open data include transparency, inclusiveness, equality of opportunities, universal participation. Yeah, and research integrity, on the other hand, comes in terms of good research practices. So essentially good research practices that allow researchers to avoid behaviors that would harm the validity and trustworthiness of their work. And some of the values of research integrity include honesty, transparency, accountability, and from just the definitions and the overall goals, we're seeing that there are common terms between both open science and research integrity. So honesty, transparency, accountability. And with this, both open science and research integrity therefore feed each other. They might have different focuses, but the overarching goals are the same. So accountability with open data, uh, citizens can question the results that researchers put out and the methods. And with open data, it allows that for people to replicate what researchers have already done and see that the work that they've put out is actually true and trustworthy. In research integrity, it advocates for rigorous conduct of research. Essentially, you can say it's the same. Open data makes people do rigorous research. Research integrity just solidifies this by telling people that there is need for rigorous conduct of research. You shouldn't falsify data or fabricate it because it looks into all of these aspects. With this, we have seen some major benefits from open data. So, for example, in health research, COVID-19 is a very brilliant example of how how open data really drove science or drove research, and the benefits that open health data can, the benefit to time and impact that it can have in overall health. So trackers like the John Hopkins University Open COVID Tracker allowed for quick dissemination of transmission patterns, vaccine efficacy, and this allowed for quick sendback and quick transformations in the vaccines, in the type of results that are being put out, and therefore mitigation strategies by different governments. We have UK Biobank's open access data, which is really driving research and results in the cancer field, which is amazing, by them just putting out insights into different genetic predispositions. From the global south, we have, even though many countries, for example, in Africa, are still lagging behind in the way that they collect and store their data. So even though we lack electronic health data records, governments are putting out information about health facilities, their locations and services, and therefore this helps to disseminate different resources by NGOs, other funding bodies from outside, which essentially covers different gaps in the health sector in the global south. In environmental research, we are seeing different types of, we're also seeing quite big advances. So a big driver of climate data science is the NASA's Earth observing system. So this has really helped in putting out a lot of climate data models, prediction models, because the data is really recent. It's always modified. We have image data, satellite data, we have air quality data. There's a lot coming out from NASA, and that is really transforming how climate science research is being carried out. We have World Air Quality Index data that monitors air quality. It's really transforming, for example, how how hospitals respond to, for example, during the spring, which is something that I experienced here for the first time in the UK, many hospitals were able to stock up on allergy medications because they are able to know the amount of pollen in the air, and they're able to know that we do anticipate quite a number of cases, allergy cases, because the pollen count is now high, which is an amazing thing to see. The data is open, they're able to do that research, and results turnaround is also really fast. In the global south, for example, we have projects like the Western African Water Assessment Project, creating information about water availability and quality. Open data is helping to save rainforest deforestation in Brazil. So also in environmental research, it's becoming quite beneficial to have open data. And then when you put all this together, we have research from about air quality and respiratory health. As we are increasing the number of vehicles in our countries, we are reducing the number of trees. When we're cutting down trees, how is that impacting our health? We're seeing research coming out quite fast thanks to open data, both health and environment data. So we have studies like the air quality and asthma study in the US. We have the same study, but in India. We have malaria and climate data in sub-Saharan Africa. Malaria is still quite a big problem, and climate change is affecting how the vector-borne diseases are affecting different people in sub-Saharan Africa. So that is, open data is allowing that research to go on, and the changes that are happening, we're able to see them more practically thanks to open data. And I am putting this separately so that we are able to see the types of projects that are coming out of the different parts of the world, and the types of data that are coming out of the different parts of the world, which essentially inform the types of policies, data policies that govern the different types of data and the different types, in the different countries. Because as we are seeing, we saw with COVID, we're seeing with climate change, data, diseases cross boundaries. They're not bound by national boundaries. Data is also not bound by national borders. So we need policies that govern how that sharing happens so that no one is losing, everyone is gaining, and the need for even more collaboration. So policies create structure for managing this data and to make it compliant with regulations, privacy, and ensuring data quality. So we have different policies that govern health data, govern environment data, govern open data, and all these are listed here. And one of the things that I should mention is seeing that most of these are made in the global north. So for example, HIPAA is based in the US. The GDPR is an EU regulation of data protection and privacy. But the GDPR created, or is the backbone of many of the data policies that were created in Africa. So for example, the Nigerian Data Protection Regulation, the Kenyan Data Protection Act, and South Africa's POPIA all have the GDPR as their backbone. So they adopted that and changed it to fit their own country's needs. So, and then we have policies like the Group of Earth Observations, which is also international. FAIR principles govern open data so entirely. It's worldwide, both for health and environment, and also the data citation index. And with this understanding that not just data which crosses different borders, since we know that policies, we have to understand each other's policies. Essentially, individuals or research institutions in the global south, they had to understand the type of policies that, for example, GDPR for them, and they had to understand their own systems for them to be able to tweak GDPR. That means we have a global understanding of policies. We also have a global understanding of data, because data is traveling. And research integrity, I do believe things like morals, honesty, integrity. As a researcher in Kenya, I have met individuals in the UK, and they are all driven by the same principles. I want to be honest, I am trustworthy. All this, again, it's global. So this is just to say that seeing that it's now one big place. It's not separated. It's becoming one. It's all these are interlinked. Policies, they help to create that attitude of accountability. They help to create that consistency. They hold people, they ensure that responsibility to do good research, and that accountability to ensure that data is actually solid for people to use. All this eventually feed into research integrity. So we have open data, which drives research. We have the individual's integrity, which ultimately drives them to put out good research. And then we have policy that solidifies this. We are ensuring that a high level of honesty, trustworthiness is maintained. And with this, we have so many different people now feeding into this one wheel, or one aspect. We have policymakers, we have researchers, we have the data creators. So for health, we have patients, we have all these different stakeholders that need to essentially work together, understand each other, understand all the different components to be able to build one system that all of them understand it, so that they're able to all be held accountable by the one policy that, the policies that they are under, and the morals that they carry themselves. So all the different stakeholders, it requires teamwork, it requires exchange. We're already seeing exchange of policies. Like I mentioned, GDPR feeding into the different policies that are built by Africa. That is exchange. That is also inspiration. That is sharing. Data being able to cross the different boundaries. We are seeing malaria research coming from the US, coming from Switzerland. That ensures that there's success. That ensures that there's also trust. The support that I've mentioned, different organizations in Africa, different countries, for them to be able to fill those gaps, filling in aspects of health inequity. NGOs are given funding by institutions in the global north. So we do need to have that collaboration in policy development to be able to hold each other accountable as all of us. And clearly, all of us understand the importance of it. So if we all have the understanding of the importance, if we all have the understanding of the technical aspects of it, that means collaboration should essentially be easy to be able to develop these policies. So with this, what then is the future direction of policy and research integrity? There's definitely need for more cooperation, more collaboration among all these individual people. Just a backstory. For the first part of my PhD, I have essentially had to talk to people. I did qualitative analysis, or I did qualitative research. And indeed, it included talking to people in health, talking to people in environment, and then talking to people in health and environment. And some of the terms that health people use are some of the it is the same thing that in the environment person means, but the terminology is different. So there's a miscommunication at that point. And if they had a conversation, they would be able to see this and be able to align with each other, right? So we need to talk more with each other in terms of the different disciplines, health and environment, the different countries, global north and global south, the different individuals in the whole journey, policymakers, researchers, stakeholders. We need people who understand each other, understand the different terms, understand the technical bits of it, understand it all, right? And this understanding will come from talking to each other. So let's meet, let's talk, let's cooperate, let's collaborate. And one of the main things that I do believe we're going to start seeing is the need to co-design global data literacy programs and policy education programs. And with these, I believe that the transfer of data is going to be seamless. We're going to start seeing, so currently there's a lag in churning out results for research subjects such as the impact of climate change on health. There's a lag of a few years, but with this, when we co-design data literacy and policy programs, I believe it's going to increase speed significantly, I think, for us to be able to see a reduction in the time of churning out results. And yeah, just to put it all together, when we integrate open data and robust policy frameworks, all these are essential for ensuring research integrity and driving advancements in health and environmental sciences. And this collaboration will definitely foster transparency, innovation, equitable access, and ultimately leading to better outcomes for everyone in society. Yeah, and with this, I'd like to very much thank my supervisors, that's Professor Caroline J. and David Topping, for encouraging me to talk to people more. And now I'm passing on that message. Let's talk more. Noemi, who introduced me to the NRIN community, Ben Manya and Ruth Manjala, who are friends who helped me put together this presentation, and NRIN for having me. And maybe to mention one last thing, I am looking for more participants for my PhD study. So if you're a policymaker, a researcher working with health and environment research, and you're in this space and would like to take part in a study, reach me on this email. Yeah, and I'd love to talk. So thank you so much, and questions are now welcome. Thank you.